everybody, this is Dr. Mridula V. Amarnath and welcome to my YouTube channel. So if you haven't subscribed, then please subscribe right away because I'm going to take you through this beautiful journey of pregnancy. If you haven't seen my previous videos, make sure you have a look at them too. So today I'm going to talk to you about miscarriages, where it is a very, very painful situation. Probably you will only realize it when you have gone through it, and I hope none of you go through it. It is extremely painful. You get that good news of you're pregnant and you're completely in a different elated mood, and suddenly when this sort of a thing happens, it really pushes you down. But then there's another part to it. One miscarriage or probably 2 or 3 miscarriages is fine because you will still be pregnant. It is not going to stop you from being pregnant. But that's not the point. The point is, if you have repeated miscarriages, it is important to note why you have had this. So, generally most of the times the underlying cause cannot be found out. But at least to be on the safer side, it is important that you do these couple of tests to rule out if these could be the reasons why you've had the miscarriage, and accordingly do the necessary actions and precautions that can be taken. So stay tuned. So some of the possible causes of recurrent miscarriage are: 1. If you have uncontrolled diabetes. So make sure you control it with diet and medication. Lupus or other autoimmune disease. Again, this can be controlled with medication. Now, if you have a history of thyroid disease, this can be controlled with medicines, and sometimes you might also require surgery. Certain pelvic infections can be treated with antibiotics. Now, in case if there is an abnormal uterus or cervix, probably there's a deformity in the structure or the anatomy of the uterus and cervix, which could be the reason for your miscarriage, then probably you will have to evaluate it and look for surgery as an option. Tobacco, alcohol, and drug certainly can be the key factors for miscarriage. So make sure you immediately stop it. Parents' chromosomes. Now, certain chromosomal or genetic abnormalities can also cause this. So if you have, miscarriage happening recurrently, then it is important that you consider doing a genetic testing and evaluating. So like I said many a times, the exact cause for the miscarriage is still not known. But, in case if you've been having miscarriages back to back, then like I said, it is important that you tell your doctor so that the doctor can also be extra cautious and you can be monitored regularly. The blood tests and the screening tests can be done so that, we can have the pregnancy can be continued. So studies have shown that if you successfully reach 13 weeks with a normally appearing fetus as well as the heartbeat in the ultrasound, then you can be rest assured that you will be able to complete this journey of pregnancy and deliver a healthy baby in most cases. Okay, so the underlying factor or the take-home message would be that 1, if you've had recurrent miscarriages, you can still be pregnant. It is not the end of pregnancy. And the second one is, it is important that you know why this has happened and do not ignore it, because each time you go through it, it is extremely traumatic and painful. So it is important that you know why this has happened. So if you have to do a couple of extra blood tests, please go ahead and do it. Do not be reluctant in doing it. You must go through it, and it is extra care that you will have to take, that you must do it so that you have a safe pregnancy. Thank you.